which type of lymphadenopathy was most likely present in the physical examination that made the PCP make this referral. So what's happening here? There's a 34-year-old woman. She has come for routine checkup and she's complaining that she's not feeling like her usual self. Routine examination shows severe, significantly enlarged lymph nodes. Physician orders a full thyroid workup, TSH, T3, T4, and he also refers her to an oncologist, right? So there is a routine examination. The physician found something wrong with the thyroid, probably a thyroid enlargement, and he asked the woman to go for an oncology reference, which means he was suspecting a thyroid cancer, right? Thyroid carcinoma, which had probably metastasized to lymph nodes. So first of all, we know it is a cancer. It is a metastasized neoplasm. So the lymphadenopathy in this case would be painless. There'll be no pain. There'll be rubbery consistency of the lymph nodes. They might be matted in some cases, right? So can you tell me matted lymph nodes? Where do you see matted lymph nodes? Pseudo-matted lymph nodes and truly matted lymph nodes. Pseudo-matted is seen in TB, right? Yeah. Okay. Good. So in this case, there's a neoplasm. So we'll see painless lymphadenopathy. Now what comes to is generalized or localized. Because it is a neoplasm which first localizes to the sentinel node or the closest lymph node, it will be initially a localized lymphadenopathy. And for many years, see, in majority of malignancies, it is spread to the closest nearby group of lymph nodes. So whenever talking about carcinomas or any neoplasm, think of localized lymphadenopathy. And the answer here remains localized painless lymphadenopathy. If it is painful, it is inflammatory, it is infectious. Okay, keep that in mind. If it is painful, there is an ongoing inflammation. If it is generalized, there is a systemic disorder involved. Okay, so you will see generalized painless lymphadenopathy in maybe SLE or HIV. You'll also see painful lymphadenopathies in inflammatory conditions. SLE can present with painful lymphadenopathies. Reactive lymphadenitis is because of an acute condition that is going on. It can also be because of chronic conditions and for a few drug-induced processes. But it will usually be painful and it will be having a spontaneous resolution majority of times. Okay, moving on to the next.
Thanks for watching. Please give a thumbs up and subscribe for more.